We're going to be talking about oral medication and how to administer oral medication today. So I'm just going to clean my hands, which you should do every time you enter and leave a room. And always put your gloves on before you administer. You're always going to do 3 checks. So you're going to look at the MER before you go get the medication and check there which medication that you need. And then once you get it out, you're going to check it again. So there should always be 3 checks, and then you're going to check it again by the bedside before you give it to the patient at the bedside. And also you're going to validate their name and date of birth so you know you're giving the medication to the right person. If the medication is enteric coated or it's extended release, you're not going to crush it or put it in a solution even if the patient asks for that. Because it's going to make it go into the bloodstream too fast and work too fast. If the medication comes in a bottle with a lot of other tablets, you're going to pour what was ordered into the cap of the medication container and then put it in your cup and then give it to the patient. And you always have to watch the patient take the medication before you leave the room. You can't just leave it in there with them. And if it's a unit dose, like one of these pills, you're just going to put the entire thing in the cup and then give it to them. You don't want to take it out of the package before you give it to them. I think that's it.
We're going to be doing intramuscular injections. The first thing to remember is that you're going to do 3 checks when you're administering the medication. The first one you're going to want to check is when you are drawing up the medicine. You're going to check their name and their date of birth. The next time is when you're actually pulling the medicine into the syringe. And then the last time you're going to check is when you're with your patient. You're asking their name and their date of birth. Something you want to remember is to look for the appropriate syringe and the right medication that you're using. And so we're going to start. The first thing you want to do is pull out the thing. It's going to be sterile, and it's going to look sterile when you actually do it. You're going to pull it apart. You're going to take out the medication. I'm going to use hand hygiene. I'm going to put hand sanitizer on. And then put gloves on. And then we're going to draw up the medicines. The first thing I'm going to do is my alcohol pad, and I'm going to clean the top of the medication that we're using. And I'm going to take off the cap. And I'm going to find the amount of medication that we're going to use. This one is 3 milliliters. So we're going to just do 0.5. You want to go to not the dome looking thing, but you want to use the first line. You're going to stick it inside the medication. You're going to push down. And you're going to flip it over, and you're going to pull up the amount that you need. You're going to pull it out. And if there's a lot of air, which in this one there is, you want to flick it out. And then we're going to find our patient. This is for you. There's 4 different sites that you can use to inject. There is the deltoid muscle, which is what we're using today. There's ventral gluteal muscle. There's the dorsal gluteal muscle, which is your bottom, and then the vastus lateralis muscle, which is like halfway down your leg. I'm going to put the cap on, so I'm going to scoop it up. And then I'm going to walk over to my patient and use the alcohol pad, and I'm going to thoroughly but gently clean my patient by going in all the way out. I'm going to let the alcohol dry on her skin before I inject it. And then I'm going to take off the needle cap. I'm going to spread my fingers font, and then 2 fingers. The way I'm going to check is I'm going to find the top of the bone, and then I'm going to go 2 or 3 fingers down. inside of the deltoid muscle, and I'm going to spread my fingers apart. I'm going to tell the patient they're going to feel a little bit of a pinch when I insert the needle. I'm going to insert the needle, and then I'm going to squeeze the medication in, and then I'm going to pull out, and then I'm going to put it right into the sharp needles box and dispose of it. I would have like gauze or something to push on the actual injection site after I finish, and then I put a Band-Aid on.
Hi, so today I'm going to be doing transdermal. First thing you want to do is you want to put on some hand sanitizer, wash your hands, and then put on gloves. This is super important, especially with transdermal, is that you don't want to absorb anything that you're going to be administering. Specifically for nitroglyceride, you get a really bad headache, so it would not be good. Next thing I'm going to do is I'm going to look around on the patient, make sure they don't have any previous patches. If they do, I'd remove those and clean that area. Next, I'm going to find the new location that I want to use, and I am going to clean them with an alcohol swab. We're going to start in the center and move outward in a circular motion, just kind of with everything all the way around. Then I'm going to just apply the patch itself. It's pretty simple. Just kind of pull back and then do like this. And there you go. You have it there. Some of the topical, wait, no. Oh, next I'm going to initial the time, my initials, and then the time and date of when I put it on there. And after that, I'll be good to go.